when you think of pandas, you think of cute, cuddly little animals. However, the pandas we're talking about today are anything but cute or cuddly. Joining me now is Dr. Madeline Cunningham. Dr. Cunningham, thank you so much for being with us this afternoon.
Well, I'm delighted to join in.
Let's start by kind of giving everyone an overview of what PANS and PANDAS is, because it's an acronym.
Yes, Pandas was the first term given to the disease, pediatric autoimmune neuropsychiatric disorder associated with streptococcal infections, and so that's how it was named. Is this disease was originally believed to be associated with group A streptococcal infections. Then the clinicians, as they began to see the disease, realized that it wasn't just strep, that there were other diseases, and so then it became named PANS, which is pediatric acute onset neuropsychiatric syndrome. And so the two acronyms became very popular for use, although much of the work that has been done has demonstrated that they're a basal ganglion encephalitis.
Okay, and being a pandas mom myself, having a son with pandas diagnosed back when he was in first and second grade, it takes on a lot of symptoms that can be misdiagnosed for other disorders or diseases or infections. So let's kind of talk a little bit about what those symptoms are that parents might be noticing in their kid, but they're not sure what's going on.
Yes, there are sudden onset is a common symptom, and all of a sudden your child who has been making great grades in school and has been very mature suddenly either is having rages or suddenly wants to be around you, the parent, all the time, and is fearful of everything. And this includes bedtime fears, constantly wanting to be near their parents, and sometimes even regression behavior, which might include baby talk.
Yeah, I know for my son it included blinking, a blinking tic, as well as like doing things with his fingers, and it just, like you mentioned, the onset, it just happened overnight pretty much. Let's talk about what parents can do if they start to notice. Brock, I noticed his after a case of strep throat, which is what we kind of mentioned earlier with what PANS means. What do parents do, though? Because I find a lot of doctors here around Central Illinois are not familiar or educated on what PANS and PANDAS is. So what does a parent do if they're starting to notice these kind of symptoms?
Well, they certainly want to contact their pediatrician. And because we recognize this as related to group A streptococcal infections, first of all, then you would want to explain what was going on and that this disease exists and that it is related potentially to a strep throat or carriage of strep or a streptococcal infection, perhaps in any part of the body. If other infections are related, then it might be shortly after a stomach virus or shortly after a cold or mycoplasma if they've had an upper respiratory tract illness. This is a very common problem in children that develop PANDAS or PANS.
And so what's the prognosis? Is there a cure for it? How do we treat it?
Well, the first treatment, of course, would be if you have an infection, then you want to use antibiotics. And in young children that are in the 7 to 9, 10-year-old age range, the antibiotic treatment has been very successful because the infection is eradicated, and often children will get well and the symptoms will not return. However, in some children, the symptoms do return, and there are other alternatives. Basically, I spent part of my lifetime working on the autoantibodies that are present in this disease because it is an autoimmune type of encephalitis. And these can be detected as a group of antineuronal antibodies at our company, Molecular Labs. But the treatment is steroids, and in really extreme cases, it might be IVIG and rituximab, but this would be for cases that were identified as resistant to the antibiotic treatment and resistant to the steroid treatment. And I also want to interject that once these types of situations begin, families should certainly seek counseling and get a good therapist that can help their child, because this is part of the whole package. And I think why it's been so confusing to parents and to doctors is that it's not just one clinical clinician that takes care of the child. There are several, because it may be a person who is an immunologist or rheumatologist. It will be the pediatrician themselves. Potentially infectious disease people can get involved. And then you need a therapist who has a degree in psychology and can help you with counseling and trying to figure out how to cope, because that is the most important thing, is learning how to cope with this disease.
Yes, absolutely. Well, we are out of time, but I still have so many questions that hopefully we can dive into, and you'll stick around. We'll do a little web bonus for CILiving.tv where people can learn more and figure out maybe if this is something that their children is suffering from. Dr. Cunningham is actually one of the leaders behind the Cunningham Panel, which is a series of blood work that you can do to learn more, and we're going to talk about that also at Cihealth.tv. Dr. Cunningham, we appreciate you being with us this afternoon, and we will, again, share everything on Cihealth.tv as well as the web extra we're going to do right now.